Great. Uh, well, good morning, everyone. Welcome to the December 13th meeting of the Incarceration, Prevention, and Reduction Task Force. I'm Jack Hovenier, I'm the co-chair. I'm joined with Stephen Gothley, the co-chair. We're grateful you're all here. And we're going to start with the land acknowledgement statement, which says, before we begin, we acknowledge that we are gathered on traditional and unceded territory of the Lummi, Nooksack, Samish, and Sitamiamu people who have cared for and tended this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We begin this effort to acknowledge what has been buried by honoring the truth. We pay respect to their elders, past and present. So please take a moment to consider the many legacies of violence, displacement, migration, and settlement that bring us together here today. And please join us in uncovering such truths at any and all public events. We have a small change to the agenda. It's my understanding, and Stephen, by all means, step in if I get this wrong. I believe we're going to do item 2, the task force and committee calendar. Then we're going to take item number 4, because it seems logical to do that prior to an amendment to our county council report, which relates to the discussion in step 4, which is the next steps for the task force in 2022. Is that, Stephen, is that your understanding?
That's correct, Jack.
Okay, so great. So the first order of business, I suspect, hopefully, is fairly simple. Jill, do you want to put the calendar on the screen? Would that be easy to do, or does everybody have it?
Yeah, I can share it. Just give me one moment to do that.
Sure, okay. I think it's page 3 of the packet.
I will say this is an updated calendar after the steering committee discussion. The only change is adding or clarifying the first meeting for steering committee in January is January 6th.
Okay. Is there any, before we go to a motion to approve, is there any discussion, concerns, questions about the 2022 regular meeting calendar? I don't see anything, so I think we're good. So, it's always a little interesting doing a vote on Zoom with some people with cameras on and off. So I think the way I'd like to do this, unless someone has a different idea, is we'll have a motion, we'll have a second, and then I'm going to ask for a voice acclamation, all in favor, and then I will ask if there are any abstentions or oppositions to make sure we capture those if there are any. Jill, will that work?
Yes, that will work. Thank you.
Okay, great. Okay, do we have a motion to approve the 2022 regular meeting schedule?
Move approval.
Thank you, Councilman Hamel. And do we have a second?
Second.
Thank you, Councilman Buchanan. All right. So this will be a voice vote. All in favor of approving the 2022 task force meeting calendar, please say aye.
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 Okay. Are there any opposition? Any person in opposition? And does anyone wish or need to be an abstention? Okay, I see no abstentions, no opposition, and I'm going to call this the motion passes with a unanimous vote. I think now we are at the point, Stephen, I know you were I'm going to turn this over to you for item number 4, which is now item number 3.
Yes. So you'll see that we are set up to discuss a measure passed by the county council last week, I believe. And I think the best course of action here would be to turn it over to Councilmember Buchanan to walk us through what's in store for us in 2022.
Thanks, Stephen. Appreciate that. I guess to start out with, I'm going to kind of review the history of the project so we can kind of get on the same page going forward. If you remember right, this project, which we call the, let's see, I don't even have it written here, the Whatcom Public Health and Safety and Justice Initiative, started back in really 2018 with the listening sessions that the council did and then went out into the county to find out constituents' opinions on the jail, especially regarding the initiatives, both which failed. So we gathered a lot of information during that first phase of this. One thing that we heard loud and clear from all areas of the county was that punishment, treatment was much more desirable over punishment whenever possible. So that was really the feeling in the county. So as we move forward with putting the project together, we kept that heavily in the forefront of the discussions. The council formed a stakeholder advisory committee to look at this and kind of vet the process, and just to have that public engagement that's so important on initiatives like this. We put that together in 2019. At the end of 2019, that committee was appointed, and we were getting ready to roll. We had a contract in place with HOK that was going to help lead the effort through the needs assessment, and COVID hit, and our first meeting was scheduled in March of 2020. So that whole effort got dissolved over the last couple of years. When we kind of reemerged to talk about this again, Sheriff Elfo, myself, Executive Sadhu, and Prosecutor Ritchie talked about how we might do this going forward with more of a local flavor on a needs assessment, rather than having essentially was a jail planner that was going to be doing this work. And we've been criticized by the public over that for years, about, having a jail planner looking at needs assessment for a jail. So the thought is that we could move away from that and really have more local control over this needs assessment. And the one thing that came to mind is that we needed something to replace kind of that steering function that the HOK was going to do. So we came up with the thought that the task force is an already established wonderful infrastructure for criminal justice evaluation and diversion programs, and the work we've done over the last several years, including, which is very important to mention, is the crisis stabilization facility. We were involved in all aspects of that in terms of capacities, and capacities were pretty much identified, I guess, by Medicaid, but we really dug into that as a task force, and were successful in opening that project this year. So it kind of made sense to involve the task force in this effort in some way. And so last Tuesday, the council unanimously approved a motion to ask the task force to put this onto their 2022 work plan as an assist to this effort. We felt that it was all the right people, all the right disciplines were there. It's something that's already in place. I know Sheriff Elfo has mentioned that, whether or not we use this as the Law and Justice Council or the task force, I don't know that I have any preference either way. I think as long as we can utilize our committee structure that we have set up by the task force, doing the Law and Justice Council is fine. But if Jill, if you could throw up the proposed amendment to the draft year-end report, I think that summarizes things, and then we'll move on to that. We've created a draft work plan. This is very draft. I'll explain that when we put that up. But Jill, if you could put up the amendment.
Yes, give me one moment here.
Sure. Can everybody see that? So the gist of this memo is what I've just explained. It identifies that the task force will work alongside the stakeholder advisory committee to support and guide the work of a staff technical advisory committee, which is our law enforcement correction staff, which is the technical advisory committee, which will be working on the technical side of things. But the IPTRF would act as a steering function and a coordinating body to help make sure that this work progresses. one of the most important parts of this work is a good communication strategy and public engagement. So a few months ago, I put in a budget request. At the time, we didn't even know we were going to do this project, but we put in a budget request for a placeholder for a communications specialist consultant to help the task force. And we felt that they can help us design a good public engagement plan as well out of that effort. So that's going to be added to that kind of scope of work and RFP that goes out for that effort. Okay, Joe, can you put up the material that you sent me? So this next piece is the actual memo that the council considered for their motion. And if you could go to the top of that, Joe.
What you're asking for, Barry?
Well, this is okay. This is fine. Well, I was looking for the actual memo, which was the first page of the
okay.
packet you sent me.
Okay, just give me a second here to
Sure.
pull that up.
Moonwater.
Oh, you can hold off on answering this question in the moment if you'd prefer, but I was just curious about membership for 2022 and beyond for the task force and then for the advisory committee, and if that's been solidified. I know my term is coming up, and I was just curious if that's similar for other folks who've been on this for a while, and if new folks have been identified, or if any assistance is needed in encouraging folks to apply for vacancies. So
We'll deal with that at the end of the meeting, I think.
okay, great.
Jill, can you take note? We'll make sure that we do discuss that.
Yes, of course. Is this the memo that you would like shared,
Yes,
Barry?
yes.
Okay.
And then I want the last piece that you put up next. So this was the memo that I sent to the council. It was outlining. It was actually an update from a memo that was done in 2019 that established the Stakeholder Advisory Committee. And this memo here is something that Jill graciously kind of deconstructed as when we get into the next piece of the presentation, and we started drafting a work plan. And like I said before, this is in the very early stages. We just started working on this last week, so there's much editing to be done. The steering committee took a look at it on Thursday of last week and made some edits, but this will be a work in progress document as we solidify how we want this work to go forward. So go ahead and scroll down, Jill, on this document. Okay, so this is the anticipated process, and we talked a little bit about the importance of public engagement. Can you go to that piece, Jill, the public engagement piece?
I'm not there. There we go.
Yeah,
Community engagement.
Yeah, the community engagement piece is here, and it talks about how we built this. A lot of these principles were identified in a resolution done actually back in 2015 regarding the Stepping Up initiative, and also in 2019 there was a very detailed resolution that was planning principles. That was, well, actually 2016 072 was incarceration planning principles, and it really went deep into the how we can use how the task force has been creating diversion programs, and it really lists a lot of the opportunities that we have to be holistic in the program that we do. And then it went into just basically 3 phases. Phase 1 is the one we're talking about today, it's the actual needs assessment. We felt the most important thing to start out with is two things. One is a needs assessment on our behavioral health infrastructure. And the needs assessment would start out with some asset mapping. What do we have as far as programs in place, funding in place, that in our behavioral health system that the health department is working on. The next step after an asset mapping, of course, is a gap analysis to find out what we feel is missing. That'll be a lot of the work that gets done in our committees here. And then some of the other questions on the question that Vera told us that we always need to be asking: who should be in jail? And we felt that Dr. Alexis Harris, that we've had talk to us in the last few months, would be very valuable in helping us understand some of the data. So we have that idea. I think Stephen's going to be contacting her to be able to help out on this. But we're going to need to have some help along the way. We know that we're not asking the task force to invent content for this project, but more to steer the process and to help move it forward. So a lot of the information that we'll be getting that's super technical, we will be going out for professional services on, and the task force will help guide that work. So basically, that's what we want to accomplish in phase one is to be able to really understand our behavioral health assets and needs, and as well as understanding the data, the criminal justice data that is so important in figuring out what our capacity needs are for a newer facility. I think some of the discussion has really focused around thinking a little larger than just corrections and thinking into how we could create almost a wellness campus or a big public safety and public health campus that would be able to be much more holistic than some of the other projects that we proposed earlier, because we think that's important to both the effort and that's what the public is looking for is that treatment over punishment. Okay, Jill, if you could scroll down or move over to the work plan. And again, this is draft, but we felt we needed to start putting some things on paper to identify kind of who does what and how. And so this again, I'm not going to spend a whole lot of time on this because it's a work in progress, but we have a facilitator picked out to help us guide the work of the Stakeholder Advisory Committee. That'll be Crossroads Consulting and Holly O'Neill and Marty. And because it's a 36-member advisory committee, so it's a lot of cats to herd, as they would say. So Holly's really good at keeping a group that large focused. So her and Marty are going to be super important to the success of this project. So as we go through, we've got that contract. I think it's probably going to be signed this week. The council was informed. It's a very low cost contract. If you could scroll down again, Jill. There's the communications consultant that we've identified a need for. Below that, under this community engagement block, we've just listed some things we felt were just ideas to throw out that would be viable public engagement strategies. The council just thought, we'll throw out some ideas. Go ahead and scroll down, please. Then we get into the meat of it, which is the behavioral health and public safety, kind of the needs assessment, where we do our asset mapping, gap analysis. And Jill created this little table down here that kind of deconstructs the memo that I provided to the council and takes the action items, and we start identifying, what entity is going to work on those, and kind of some notes over there to the right about how we do that. You see, there's still a lot of questions like itemize of our revenue streams and funding, current only, going back how far. So there's still some questions that we need to ask ourselves about, how how we focus our work and what lenses we look through. The gap analysis, we may need some help with that. We may need Dr. Like I said, Dr. Alexis Harris to identify data to be collected and analyzed, and then maybe we will need a data analyst actually to integrate that data information into our planning. Scroll down again, please. Yeah, this is the stuff this task force is really good at: diversion alternatives and policies and treatment options. And then we have, via the task force, we have our prosecutor and law enforcement that can help us with a lot of the requirements of the law that we have that are relevant certainly to this. Then we look for projections, all the stuff that you would expect that you'd have to analyze and identify in a needs assessment. So again, this is just a very rough draft and a start of, but we wanted to show you something, kind of what our thinking is and how this work can take place. I think that's probably, is there anything, scroll down again, Jill? Oh, kind of the who will decide. This will be a very big joint effort. The council obviously will be, blessing the final plan when we get down the road, but the council will take all the input that's derived out of this effort from the stakeholder advisory committee, from our task force, and we will then roll into what will be, phase 2 and phase 3, which are more, architectural in nature. On phase 2, design and looking at some alternative analysis on different styles of facilities. And then phase 3 is the financial side, which is pretty complicated when you start dealing with, cost sharing between all the jurisdictions in Whatcom County. Those are some complicated interlocal agreements that need to be agreed upon by all entities. So that's kind of in a nutshell what the council is asking. And like I said, we're trying to formulate a plan now to move it forward. The first stakeholder advisory committee meeting is scheduled for January 20th. That'll be mostly catch up for everybody and kind of a Project 101 discussion, and just reviewing the history of the project and kind of the expectations going forward. Can you scroll down again all the way down to the sequential intercept model?
Oh, that's in a different document.
Oh,
Give me
okay.
one moment while I pull that up.
We thought a good way to kind of start that, jumpstart the behavioral health needs assessment piece was to take a look at the intercept model that the task force developed for one of our reports a couple years ago, in which we took the intercept model and again deconstructed that and listed programs that we have, A, in progress, B, that are dreamed about but not funded, and ones that haven't even been dreamt about yet. So that's kind of a good baseline start. We just included that. I just included that today just to show you kind of where we think we need to kind of focus the work around the intercept model, because the task force has used this for numerous decision points and our own mapping systems that we've done to identify what programs that we have in place. So these are the ones that programs are already in place. The ones that are in blue are the ones that are direct result or have been expanded through work from this task force. So as you see, there's quite a few that the task force has been involved directly in. And anyway, that's just kind of an example for helping the work to get started. Okay, Jill, you can take that down. Thank you. Anyway, I know that there's going to be lots of questions, so I'm going to stop there. I think that kind of illustrates kind of what the thinking is, the vision of the program, and again, all that work plan is work in progress, and it's certainly not cast in stone at this point. So, anyway, questions? Dan.
Okay, so I'm a little confused here. I was invited to a Justice Project SAC #1 virtual meeting on January 20th. But I'm not, I'm confused as to the structure, I guess. Can you enlighten me here?
Well, there are people that are on both the SAC and the task force because
Okay.
we'd asked for members of the. That's one of the some of the roles are right out of the behavioral health side, and the co-chairs are also members.
The co-chairs are members of the SAC.
Yes.
Okay, that's fine. I'm just trying to get it straight. I looked at the roster on the SAC on the county's website, and I didn't see my name in that list, but I kept getting the invitations, and I just assumed that the co-chairs are part of that group. But I just want to make sure I'm on the correct list, so so I get all the correspondence and everything.
So if we didn't understand Barry's presentation clearly, the bottom line of it is this is a plane that we're in the air and still building. And so it's going to involve the SAC, the membership there, which does have cross membership. It's going to involve the task force as a whole at different points along the way. It's going to involve a lot of coordination through the task force steering committee. And then each of us who might be on one or the other of any of those groups will be involved individually. It'll probably also draw in some of the specialized expertise of our subcommittees. So how all of those pieces are going to fit, I don't think is clear yet. And so Barry couldn't really outline the precise interactions and scopes of work of any of those bodies. But that's something that's going to be developed. Am I right, Barry?
Yeah, and the SAC will be working very closely with the task force. Really, it's one big team. So some of that cross-pollination is a good thing, in my opinion.
And I saw someplace in our materials, maybe it was your memo, that there are 31 of the 36 seats already designated, but there are 5 vacancies still to be filled. Is that the current status?
It may be 4. We filled 1 last Tuesday. I don't know if that was part of the 5 vacancies or if there was an additional one. But Jill, do you know the answer to that?
Find out that information and let you know.
Okay. So
to part A of Moonwater's question, there may still be vacancies on the stakeholder advisory committee, and any of us who are interested or any of us who know somebody else who might be interested, you might check with Jill to express that interest in a formal way.
Yeah, we reposted for those vacancies, but we probably should do that again.
Sorry, Barry, I interrupted you there.
No, that's okay, Stephen. I need some clarification sometimes. I appreciate it.
There are currently 4 vacancies for the Stakeholder Advisory Committee, 2 citizen criminal justice advocate positions, 1 citizen behavioral health advocate, and 1 individual with lived experience in the criminal justice system.
So yeah, so my recollection was correct. We did fill the 1 of those 5, and there's 4 left to fill. Any other questions on kind of our concept here? All right, well, thanks. So I'll turn it back over to you, Stephen and Jack.
Okay, so our preliminary discussion suggested that the council asked us to do this. So it's not something we really need formal action on, but we are about to take up the inclusion of this in our year-end report in the what's next section. So in adopting that, we'll be authorizing this work to be done, however it starts to roll out. I'll just add that in Barry's presentation, the steering committee, it became clear that a lot of the needs assessment and jail sizing kinds of considerations will depend on data that we've become very clear over the last couple of years we do not have. And so I don't know if there's a smiley face icon on Caleb's reactions, Zoom reactions, but we're hoping that this will kick us into the next phase of Index's work that he's set up so nicely to actually develop data gathering and data information systems that can support new programs and a new system of facilities and treatment programs. The other thing is that this nicely forwards what Councilmember Hamel has advocated for quite a while, is the communication strategy that we've agreed is necessary in principle, but we haven't really been able to actualize in a concrete way. And so hopefully this will speed that up by incorporating it into a larger communication strategy. And I'll just add that one thing I would encourage everybody to keep in mind is that this does not supersede ongoing work that is already underway in the task force or that might be identified as important to the task force. This is a sidecar, a big sidecar, but not all of the task force's work for 2022. So I just want everybody not to feel co-opted by this or allow us to be co-opted by this entirely. The committees are doing really valuable work on their own, and they should be encouraged to keep that up. So Jack, I'll turn this over to you.
And I just add one more thing to what Stephen just said. I think that a lot of this work dovetails nicely, and Stephen mentioned the index committee. You know, there's some work that we can do, especially when we go out for professional services, that we can fold, you know, task force work into those efforts. And I think we'll grow both sides of that issue. I think both the task force and the effort for the initiative will benefit from working together like that. So.
Thank you, Barry. Okay, Jack, I'm going to turn it over to you for the year-end report.
Okay. Thank you. Thank you, Barry. So the issue with the year-end report is we have a proposed amendment that I'm pulling up. And I think, no, that's my screen, not Jill's screen. Okay. All right. So we have a proposed amendment, and that amendment relates to the discussion we just had. The only context I'd like to give is for those of us that have been involved in this task force for a long time, it does seem, to me at least, appropriate that this task force participate in what Barry's talking about. And I understand that's philosophically a little different than when we started, and we scrupulously avoided trying to have opinions about the jail and instead talked about how we could reduce incarceration regardless of the jail. But at this point, it seems to me this task force is functioning pretty well. We have quite a bit of information from the voters in the community. As Barry stated, we have a pretty good sense of what the community wants. And on a personal level, I'm glad that we are going to be involved in this. I think it's appropriate. I guess that's an opinion which chairs generally shouldn't have, but it's nice to see it kind of come full circle from where we began. So we have an amendment. Jill, would you like to throw the amendment language on the screen? And then we will need someone to make a motion to approve that amendment to our year-end report. And I think if you scroll down just a little bit.
So this one that you're seeing right here is the first amendment proposed to add the Justice Project to the work.
Oh, got it.
of the
Okay.
Task force.
All right.
There is a second amendment down below.
Perfect. Okay, so that's an amendment as well. So the amendment then would be, is this actually a motion then to guide that? Okay, oh yeah, because we're going to include this portion. Got it. Okay, So the amendment would be to add the Guide the Justice Project Needs Assessment narrative as displayed on the screen under subsection B to the annual year-end annual report. Is that correct, Joe?
Yes, that's exactly it. Thank
Okay,
you.
so we're going to add, so just so everybody understands, we're going to add these 3 paragraphs into our report. That's what this amendment is. So would someone be willing to make a motion to amend the annual report by including the Guide the Justice Project Needs Assessment as displayed on the screen to the year-end annual report?
So moved.
Thank you, Councilman Hamel. Do I have a second? It's very quiet.
Second.
All right. We have a second from Barry. All right. Is there any discussion? I see your hand up. Dan, is your hand up from the, okay.
No, it's up because I just want to get a little further clarity on these bodies that are working towards the outcomes that we're talking about here. So Justice Project Needs Assessment would help guide the SAC and then work concurrently with the Law and Justice Committee, aka Incarceration Prevention and Reduction Task Force, to advise the county. Am I getting the order of operations like roughly there?
Yes, yeah, you have the idea correct. That would be a team that works together to provide recommendations to the county.
Okay, and the Justice Project Needs Assessment would be pursuant to that first phase of providing. It wouldn't be the technical stuff necessarily. It would be more of the, here's where we're at and here's what we think we need. Is that roughly correct?
Yeah, we would get that technical information. We wouldn't generate it, but we might get that from a consultant, say this, as an example. And then we would, chew on that, and then we would have a recommendation for a policy for the project going forward.
Okay, I just want to make sure I could support my own motion. Thank you.
That's a good thing. Moonwater.
So just for a little bit more clarity, is the intention then that the task force as it currently stands would become a body that would weigh in with an opinion on the size, scope, and location of a new jail down the road? Or is this motion specifically about the needs assessment component of the work plan?
I'm going to let Barry answer that because I can see why with what I said you might wonder about that. But I do think this is a tiered approach. Barry, would you like to try to answer that?
Yeah, I think the those hard numbers that you're talking about, as far as the location and size and stuff, would be a product of the needs assessment. So I think the needs assessment, we would be focused on the needs assessment itself. When we get down to the end of the needs assessment, the SAC will be largely tasked with that recommendation for those kind of hard numbers. But I think they're going to do it in conjunction with the data that they get out of the task force and the recommendations that we can give for instance, for diversion opportunities and things that affect those numbers. So that would be more of what the task force's work would be.
So I'm trying to puzzle through this, and I may not have clarity by the time it comes to vote on this, but I'm wondering if there would be a public perception of a conflict of interest if the task force at some point is tasked with weighing in on, again, the existence, location, scope of a new jail while concurrently focused on reduction and prevention. So I'm mulling that over and wondering if anyone else has given what level of thought has been given to that and sort of how that fits into the distinct roles of these different bodies. I welcome any input as other folks have wrestled with that.
I saw Sheriff Elfo raise his hand.
I was going to say that the Law and Justice Council is statutorily charged with making those types of recommendations under state law. And it's my understanding the Incarceration Prevention Task Force and the Law and Justice Council were one and the same. So I don't think it would be inappropriate.
In Moonwater, I would share the sheriff's opinion. Perhaps it was different prior to that, but I think one could actually make the case that now that we also act as a Law and Justice Council, it would be inappropriate for us not to participate.
Dan?
I see a confluence of interest, not a conflict here, because I think that this group does need to weigh in on actual outputs and outcomes. And then to the sheriff's point, it's statutorily obligated, I guess would be the word I would use. Or authorized.
Stephen?
I appreciate Moonwater's concern for public perception on this. And so I think to the extent we're dealing with strict, narrowly defined needs assessment issues, that's something that the task force itself has a great deal of expertise on and can, as identified as the task force, weigh in on. I think it might be clearer if when we participate in discussions or make recommendations to the SAC about jail size and location, that we might formally shift and act as the Law and Justice Council, so that it's clear where those recommendations might be coming from and what the appropriate scope for making them is.
Thank you, Stephen. That makes a lot of sense, because again, Moonwater, you've been here from the beginning, so you know the history of how we kind of avoided some of this in order to have consensus on those issues we could agree on. So I think we're still exploring it, but certainly the Law and Justice Council function informs this decision. Yes.
Just to flag, I think as has come out in this meeting itself, and it's new and still forming, but with these different committees and the overlap of membership, I think it all the more reason and value for the communications support. And one of the key messages for that consultant to work with and support is helping the community understand the different structures and committees and interests, where they align and where they're distinct. So I can see even more the value of that from the public's perspective to help untangle some of this and see where it's a giant Venn diagram, but where the overlap and confluence is, but the distinctions too, because there are so many similar folks sitting at multiple tables, and sort of how to tease that apart for the public will be helpful.
Yeah, I agree, Moonwater. I think the public engagement piece is one of the most important for all aspects of this.
And if the decisions get thorny, thanks to Mayor Courthouse and others, we now have our decision-making process thoroughly vetted. So I appreciate that as well. All right, are we ready for a decision on this? Is there any further discussion? All right, we're going to use the same approach, which will be affirmative with the voice, and then I will ask for abstentions and ask for opposition. All in favor of approving the motion to include the Guide the Justice Project Needs Assessment narrative into the year-end annual report, please say aye.
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 Aye. Aye.
Is anyone opposed? Does anyone wish to abstain?
Aye.
Who was that?
Byron.
Byron. Hi, Byron. Thank you. Okay, so we have one abstention. The motion passes with one abstention is probably the best way to say that. Okay, moving to proposed amendment 2 from Mike Parker. And this would be to include from the Behavioral Health Committee the section on youth and young adult prevention. I think, Mike, if you are on, I know you're there, yeah, there you are. If you want to read this and speak to this, I think that's probably the most appropriate way to proceed.
Sure. Thanks, Jack. And thanks for having me on. I'm off camera today because I've got my little girl with me today. And she's a little distracting. So also in our committee, this is a little bit of a recap of what we were doing in 2021. And near the end of the year, we really started drilling down on this a little bit. So we wanted to have this included. So I'll just go ahead and just read it off to you really quick in case there are others who don't have a screen. So we began evaluating upstream prevention work around engaging youth. And on our behavioral health subcommittee, we've got Chris Cochran from the Bellingham Public Schools, who gave a really good webinar and kind of grounded the committee into what's happening from a school district perspective. And obviously our subcommittee wants to continue that work and find where there are areas of synergy between Bellingham School District and other school district work, and how that affects youth, and obviously then keeping them out of a criminal justice system. So this is really just an update to round out the work that was done in 2021, and we do intend to keep that going forward in 2022.
Okay, and to be clear, the motion would be to include the paragraph below youth and young adult prevention into the Behavioral Health Committee report for the year-end 2021 annual report. Is that correct?
That is correct.
Okay. All right. Are there any questions or clarifications anybody wishes to ask? See, oh, yep, Dan or Councilman Hamel.
Sorry about that, kind of late on the draw. I just wanted to state my support for this. We all know that when people enter the criminal justice system as adults, it didn't just begin that day, that there were other elements leading up to that, including ACEs, adverse childhood experiences, and other issues, including substance use disorder, mental health, illness. And I think this task force is historically only focused on adults in the system. And this is enough of a diversion that I just wanted to state my support so that folks understand our intent with bringing a person like Chris Cochran onto the Behavioral Health Committee to provide this information. I think it's valuable. And I think these deeper dives upstream, without using too many water analogies, are very important, so that we have a better understanding and can address issues as we see people who are adults in the system. So thank you.
Stephen, I didn't ask anyone to make the, well, I guess Mike is making the motion, actually, by definition, because he's brought it. So Mike, I assume.
Excuse me, Jack, Mike is not a member of the task force. Maybe
Oh.
Dan Hamill, you can make that motion.
Thank you for clarifying that, Jill. I'm so used to seeing him, and I appreciate him being here that I neglected to remember that. So Dan, would you like to make the motion then on behalf of the committee, since you're the co-chair?
Sure. So moved.
Okay, so the motion is made by Councilman Hamel. Do we have a second?
Second.
Mr. Winter, good to see you. All right. Any discussion, either for discussion on this motion? Seeing none, we'll move to decision making. We'll follow the same process. All in favor, please say aye.
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 Anyone opposed? Does anyone wish to abstain? The motion passes unanimously. All right, thanks everyone. You're making it easy today. Thank you. Stephen, back to you.
Oh, okay. So I think I'm trying to pull up my agenda here. I think the next item is committee reports, if I'm not mistaken.
Excuse me, we need one more step here on the year-end plan, is a motion, a second, and a vote to approve as amended.
Oh, okay. Sorry, Stephen. I neglected that. All right. So
that's okay.
We now need a motion from the task force to approve the entire annual report as amended, the year-end annual report. Is that correct, Jill?
Yes, that's correct.
Okay. So would someone like to make the motion to approve the year-end annual report to the county council as amended?
So moved.
Thank you, Councilman Buchanan. Do I have a second?
Second.
I'm not sure who that was, but.
That was Chief Tang.
Oh, Chief Tank. Okay, great. Thank you. Any discussion on this motion? We will proceed with the same decision making. All in favor, please say aye verbally.
Aye.
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 Anyone opposed, please indicate that verbally or wave frantically. And any abstentions? The motion to approve the year-end annual report as amended passes unanimously. All right, now am I good to pass it off to Stephen, Jill?
Yes, everyone, thank you very much.
No, thank you.
Thank you, Jill, for helping us.
We really appreciate you keeping us on track. Thank you very much. All right, Stephen.
So the next agenda item is the committee updates. We've highlighted the Behavioral Health Committee. So Dan and Mike, if you want to take that away, and I'll just preface this by also saying if there are updates from any of the other committees, we'll allow an opportunity afterwards for that. Dan and Mike.
Mike, you were the you chaired that meeting. Do you want to take us through, or how do you want to do that?
Councilmember Hammer, if you would do that, that would be great.
Okay. I know you've got a child in play there, so.
I do. She's very active right now. My apologies.
Yeah. It's all about the kids. Let me just get there real quick. Okay, so for folks' reference, I'm starting on packet page 17. Our last meeting was November 16th, 2021. Mike co-chaired the meeting, Parker co-chaired it. We talked about task force communications, and specifically committee members discuss potential campaign topics. This is pursuant to helping our consultant and helping our broader task force just get the word out. I know Arlene Feld's been a big proponent of making sure that the work that we do is not invisible. So I'll just hit a couple of the items that we talked about. Crisis Stabilization Center update, the issues around service capacity for behavioral health in the community, including challenges and existing options for treatment. And I'm going to circle back to that in just a moment here. Intersect between all first responders, making sure that the messaging that we talk about is plain, so to speak, that it's not jargony or using a lot of acronyms that are going to be confusing to people. The next item that we reviewed priority items, current status and future goals of the county health department reentry program, new contractor and connections to existing programs, handoff and community transitions. And this is basically making sure that when people are exiting systems, that they have a pathway forward. Talked about the importance of housing, the importance of interventions if needed for behavioral health issues. We reviewed admission denials at the Crisis Stabilization Center. We talked about the number of releases due to the Blake decision. These are all things that are, I don't think any of these things are new. We also hit on the issues around methamphetamine use, lack of treatment, problems with finding housing. This is something that has been recurring according to law enforcement, and we're trying to figure out a pathway forward for Recovery Navigator attached to the LEAD program and funded through the Healthcare Authority. And then the last item was items for the December joint meeting with Legal and Justice Systems Committee, which is tomorrow. And that's going to be a big one for us. We're talking about competency restorations, the log jams in the systems, COVID, how that's affecting things, severe mental health illness within the jail, and how to get people the help that we need. I think it was Councilmember Buchanan that mentioned before that, when we were doing the listening surveys and sessions, recently, that what we heard was there's a lot of emphasis on treatment and recovery versus punishment. And so we're trying to get to that, trying to understand that a little bit better in the behavioral health subcommittee. Mike, did I mostly get it sort of right? He might have his daughter.
Dan, that was an excellent summary. Thank you for that.
Okay, thanks. And I'll take any questions if there are any. Okay, seeing it, and I'll kick it back to one of the co-chairs.
Okay, thank you, Dan. I'll invite Raylene or Arlene if they want to say anything about the Legal and Justice System Subcommittee, Caleb, Index, or not sure who would speak for crisis stabilization. Raylene?
Thank you, Stephen. The last Legal and Justice, we're continuing on a series of topics on domestic violence and treatment and the lack of treatment providers and where to go with that. We've also talked about the Blake decision and other limitations from legislature. A subcommittee was formed out of our group to look at recommendations to our state representatives, which you can see in the packet. I'd like to just reiterate our upcoming meeting that Dan was talking about, because we're seeing a lot of crossover between legal and justice and behavioral health. We do have one speaker that's going to be talking from restoration. This is going to be an ongoing topic on restoration competency and reentry and navigation. They're huge topics, so it's not going to be something we're going to be able to just finish in one meeting. We'll probably be separating some of the topics from behavioral health and legal and justice, and then bring it back together at joint topics. So if you're able to attend or watch the meeting tomorrow, I think it would be very beneficial. I know this isn't a report on past, but I think it is something that we've been talking about over the years on reentry and navigation and restoration and competency, that I think it's going to be very important on moving forward. So if you can chime in next or tomorrow afternoon, I greatly appreciate it. Thank you.
Thank you, Raylene. Any questions there? Okay. Caleb, I'm assuming you don't have anything to report from Index. Okay. Perry, do you have anything from the Crisis Stabilization Center?
No, only just an update, and I've talked a little bit about this before. Sorry, Perry Maury, Human Services Supervisor with the Health Department. We meet monthly with the Crisis Stabilization Center Advisory Committee that includes providers, law enforcement, first responders, and citizens as well, to really just to talk about the progress in terms of opening the facilities, streamlining admission process, addressing challenges from each of those perspectives that I made reference to, and also have convened a sort of a breakout smaller group working with the withdrawal management side, Pioneer Human Services, and also Mike Hilly, just in regard to some details of streamlining the process of admitting individuals on behalf of law enforcement and EMS, those kinds of folks. And so that is what we're up to at this point in time. And if you'll recall, we also moved the actual Crisis Stabilization Center subcommittee meetings to quarterly at this point, and then to evaluate in terms of, in addition to reporting some information in the behavioral health subcommittee, as well as the legal and justice. That's the bulk of the information that I have.
So let me just ask you, Perry, since not all of us can follow along as closely as some others, can you give us just a sketch of the utilization data, and also anything to report on the involuntary hold issue?
Sure, I can do that. Right now, the utilization in the detox side, withdrawal management side, I've compiled a bit of data. I don't quite have it finished at this point, but they are somewhere in the region of about an 80% utilization of the available beds that they have at this point. The mental health stabilization side is a bit lower, in part because of staffing availability and some other components that that brought some challenges there. Both are obviously moving towards that. We're collecting data relative to those individuals that are referrents, and that would include law enforcement, EMS, LEAD, GRACE, MCOT, and DCRs, our designated crisis responders. Also Peace Health transfers, jail transfers, other professionals that don't include that earlier group, and also then self-referral, family, et cetera. And then we specifically broke out base camp as well. I'll be talking about that in a little more detail at the Legal and Justice Committee meeting tomorrow. What else did you ask me, Steve?
Involuntary holds.
Sorry, of course. We've actually had there's proviso dollars that are available that are being routed from the healthcare authority. From the state legislator fund through the Behavioral Health Administrative Services Organization. We've had a couple of meetings with the providers, as well as the Behavioral Health Administrative Services Organization, just to make sure that we're on the right step as far as reporting, tracking information, et cetera, and how those funds that are specifically available for the Crisis Stabilization Center as a pilot project relative to the involuntary status. Now, just a point of clarification here, because sometimes there's some confusion around this. This is not an involuntary status relative to the civil commitment, the sort of commonly heard about involuntary treatment admit. This is actually relative to the criminal code, if I recall correctly, RCW 1031-110, that speaks to the ability of a law enforcement to be able to work with an individual that has been involved in commission of a crime, typically low-level crime, give the individual an alternative to be able to go to the crisis stabilization center if that's appropriate, and then remain at the crisis stabilization center for a 12-hour period of time in lieu of being taken to the jail. And so it's a bit different than individuals that are identified by our designated crisis responders as a risk to themselves or others, and then are typically transported to an ENT or the hospital. And so we have been meeting with the BHASO, as I made reference to. I've also set up some subcommittee meetings with Compass Health specifically. They are the ones that are pursuing the involuntary status and certification. And so working with them in terms of step-by-step process, and I'll be, of course, updating with that progress, that occurs there over this next period of time. We suspect with Department of Health, which is the licensing entity, they are having some challenges just in terms of getting those certifications and licensure completed. But I will be able to update folks with more detail as I complete these meetings with the provider Compass Health that is pursuing that.
Thank you, Perry, and I'm sorry for my lack of clarity in the use of involuntary hold. I did in fact mean the law enforcement hold that you referred to. Thanks. So I see Arlene and Dan have questions. Arlene?
I'm so glad you gave that last detailed explanation of who it is that would be included in that kind of a hold. It's so different than what I had in my mind and what probably a lot of people think who would qualify for this. So that be sure that that distinction that you're talking about, that it has to do with an alternative to jail and not just severe mental illness going on. So that's terribly important.
A component of that, if I can, sorry, Stephen, a component of that is actually that an individual that's brought in for a 12-hour law enforcement hold must be seen by a mental health professional within 3 hours of being brought to the facility, which obviously we can, fulfill because there's staff there. But that is also that piece that in case the individual might meet criteria for involuntary treatment admit from a civil perspective, that would be ascertained and evaluated at that point in time, and the individual transported to the appropriate location if that were the case. So just want to make sure that yes, we are talking about a law enforcement hold, not a standard ITA and a civil commitment, but that we are evaluating the individual as part of the RCW requirement within 3 hours of them being brought to the crisis stabilization center. So ruling out, any further need that the individual might have beyond a simple 12-hour hold.
Oh, only 12 hours, not more.
Correct.
Oh, that's very important detail also.
Yes.
Thanks, Perry. Dan.
Perry, I'm wondering for tomorrow if I could just ask to get your opinion on a couple of items. For 1031-110, ITA, involuntary commitment, your opinion on removing the word imminent, and on the definition of gravely disabled, your opinion on removing the word serious harm or serious to the word harm. And then also the intersection between both of those and House Bill 1310 and where both of those land when it comes to civil versus criminal.
So I'm not absolutely certain I understand, Dan, what you're asking of me, but the language in the criminal code RCW 1031-110 does not actually speak to imminent risk, etc. That is the standard involuntary treatment admin on the civil side. That does speak to that, and that the individual is evaluated by a designated crisis responder, et cetera. However, if what you're asking about is just in terms of ensuring clarity, in regard to that RCW that's related to the law enforcement hold, it is interesting, and I was looking at it pretty closely. I can email this to you if you would like. That the RCW actually makes specific reference to 12-hour hold. That is the language that is actually used, as opposed to involuntary treatment, admission, or something of that nature, which I thought was interesting because it was, I think there was some clarification there, but I may have missed your request, your point, Dan.
Right. So I'm just hoping that you can provide some clarity to the two groups tomorrow. There's like three animating factors here. There's the criminal side, there's the 1031-110, which is the civil side. And my understanding, and correct me if I'm wrong, is that the word imminent means the interpretation from law enforcement is 1 hour from death. That means that person is going to cause harm to themselves that would result in their perishing. And so if we remove the word imminent and made it so this person may be having chronic ongoing suffering due to whatever conditions, if help could be provided through the removal of the word imminent, then what would that look like? And I'm just going to opine real quick here. The 12 hours will not help someone who has a meth dependency because it's not enough time to detox. And so I'm wondering, if you could wave a magic wand, what would that look like for the person to have restoration process? And I guess then on the criminal side, when it comes to involuntary holds, or maybe I'm not using the right word, or commitment, what the intersection with 1310 looks like from your opinion. There's been some clarification, a lot of discussion with WASPIC, rendering their opinion. AG came out with his opinion, Ferguson came out with his opinion. So I just want to get a sense of, on the ground, what does that really look like for people who could benefit from help through an intervention. I've just heard from providers that they're losing people to charges because there isn't that mid-step intervention, and so they're drawing charges and perhaps ending up in jail, but at least getting a charge on their record. And and we're all about the reduction and prevention. So I'm just trying to find a pathway through as a layperson who is interested in these topics. I hope that provides clarity.
Yeah, no, some great questions in that regard. And actually, because of the fact that the 12-hour hold and the license that I was making reference to is actually going to be through Compass Health, which provides the behavioral health stabilization services. And at this point, not Pioneer Human Services, which provides the withdrawal management and then the referral out to other kinds of services. We're working, with that right now in terms of seeing how we can capitalize on that opportunity, because they do work and cross-refer patients based on the need as the individual detoxifies and those kinds of pieces. And I think that it is a great opportunity using motivational interviewing techniques and those kinds of components. And I was really, really pleased to, on this initial, we've had a couple of meetings, but this most recent conversation with the providers relative to this 12-hour hold, that the full intent is that the Crisis Stabilization Center is much more inviting than the jail is, just in regard to where the individual might, make a choice to go, because they're essentially making an agreement with the law enforcement representative to go out there. So getting the individual in a supportive, location, being able to talk about resources and opportunities, and very likely, as we've talked about in some of the previous meetings, referring the individual if they're open to that. And methamphetamine addiction is an issue, being able to refer them to an inpatient facility, which there is a fair amount of availability in terms of inpatient locations across the state. So we do have that opportunity and option, and it is likely going to be a more effective intervention, obviously, than the individual simply being incarcerated, due to criminal behavior. So there is that piece. I did read over also the draft of House Bill 1310 amendments that were potentially going to be made in early January, and it did actually include a component of one of the concerns that we've had is that the current language of 1310 basically disallows law enforcement from transporting individuals that have been identified by a designated crisis responder as at imminent risk and needing a transport, needing transport to either the hospital or, well, the hospital would be the appropriate place at this point, or another ENT. And so my understanding is that law enforcement's interpretation is we can't transport that individual, because if the individual at some point in time of the transport says, I've changed my mind, let me out, then law enforcement actually has to stop the car and let the individual out by virtue of the current language. That language has been, or a draft has been updated that would allow and specifically makes reference to the transport of individuals that have been identified as appropriate for evaluation, further evaluation for involuntary treatment admin. Now, this is the civil commitment, which typically starts out, I'm not super familiar with the timeframes, but I believe it's a 7-day period of time. It may be a shorter period of time, and then reevaluated to either remain longer in that setting or be released to a lower level of care at that point. And so I think that that's really positive steps that are occurring relative to being able to have greater engagement with law enforcement and the support. Interestingly enough, that the RCW that we're making reference to at the end of the RCW does state that as a law enforcement individual brings a person in for a 12-hour hold and sort of follows through those steps, that they are not able to be held responsible for that. I mean, it relieves that concern that the individual law enforcement officers have in terms of what House Bill 1310 had presented from their perception. And so I definitely will be able to address that further in our meeting tomorrow and answer questions about that particular component.
Thanks for raising the question, Stan. Thanks for the pretty in-depth response, Perry, and look forward to hearing more tomorrow at the committee meeting. Sheriff Elfo.
Yeah, I just wanted to say, Council Member Hamel, I'm not sure that 1 hour defined as imminent is universally accepted by law enforcement. That may be some advice one of the law enforcement agencies have. And I just wanted to clarify, to my knowledge, unless something's come out very recently, the Attorney General has not issued any guidelines to law enforcement. The statute took effect, the changes, on July 25th, and he has till July 1st of 2022 to issue those. I know there was a memorandum that he wrote, a confidential memorandum to a state senator, I believe it was, in King County, giving his opinion, but that's not been officially provided by law enforcement, or according to at least who we get our legal advice from, the prosecuting attorney's office and other sheriffs around the state from their prosecutors, is not something that we can rely on. So the statutory amendments, if they're in fact enacted into law, will be welcomed. Thank you.
Thank you, Sheriff. Arlene.
I guess I've been thinking about what can 12 hours do, which is, to my mind, allow a little time for someone to calm down. It is not treatment. It is not addressing the serious mental illness potential problem. We don't have treatment centers for serious mental illness. So while I totally appreciate that any diversion from jail is better because of the harm that jail does to people who are already quite sick, I don't see too much developing out of 12 hours. I guess I'm concerned about that.
If I can, Stephen, just in terms of responding to that, I agree with you, of course, Arlene, that 12 hours is a limited period of time and is most certainly designed to avoid the fact that if the individual probably isn't going to be best served in the jail, that that they don't go there, and that of course law enforcement has that alternative. Fully the provider's intent, based on the fact that the individual is appropriate in terms of admission to crisis stabilization center, is to really familiarize the individual, work with skills and techniques that you're of course familiar with in terms of motivational interviewing, give the individual some food, make sure that they have a shower and their clothing is clean, etc. And that period of time, that sort of breather time to to settle down, to possibly get some sleep, depending on that dynamic. And the hope is that once the individual experiences what the crisis stabilization center is like, that as appropriate, that individual would stay for the standard length of time, which is 5 to 7 days, probably at the outside, in addition to then the process of reentry, if you will. We don't use it in that way, but in terms of services being offered and provided to the individual, whether that be, an inpatient setting, a lower level of care, connection to resources that are within the community, is the absolute intent and discussion that we've been having with the providers, who are definitely on board with that thought process. So it's a great concern, because 12 hours wouldn't do it, but it gives us an opportunity to create a rapport.
Thank you.
Thanks, Barry. Councilmember Hamel.
Just real quick, I want to respond to the sheriff. What I was referring to with the guidance from the AGO, Attorney General's office, was the confidential memo to Reps Goodman and Johnson that was made public on August 5th, 2021. But for clarity's sake, there was not a formal advisory opinion rendered, and that has yet to happen. So I agree with the sheriff.
Thank you. Any other comments related to current or future operations of the Crisis Stabilization Center? Barry, thank you very much for diving into all of that with us. I think that's it for committee updates. Jack, if you don't mind, Chief Tank.
Yes, I just want to mention that last Friday, Fire Chief Vanderveen of North Whatcom Fire and myself, we went to the Crisis Stabilization Center for a tour, and we were there maybe an hour and a half just to get a idea of the operation on both sides of the house there. And I would encourage anyone that is interested to contact Perry, because Perry helped set that tour up, and it was very informative. And I learned a lot of information that honestly I just didn't know about the center. So thanks, Perry.
My pleasure, Chief Tanks.
Thank you, Chief. So Jack, if you don't mind, I'll just move to other business. So Moonwater had a two-part question about membership in the stakeholder advisory group, which I think we addressed and encouraged applications for those vacancies. Also about end of the year changes in the membership to the task force. And I'm going to ask Jill to report on that. I'm going to lead into that and follow up with the SAC membership by reminding everybody that we have a commitment within the task force to try to increase the diversity of our membership. And this is the real opportunity to make strides toward that goal. And so as we look at applications for either the SAC or the task force, please keep that at least up in the top echelon of your considerations in encouraging new members. Jill, do you want to talk about the status of task force membership and the turn we're making here with the new year?
Yes, of course. Thank you, Stephen. The county has entered into its process to advertise for applicants for all of its boards and commissions who have terms ending on January 31st. If anyone would like to apply for any of those vacancies, applications are due in the council or executive's office by January 4th at 10 a.m. The task force specifically has 4 positions that the council will be appointing to. Sadly for me, Moonwater and Byron have termed out of their positions. So the January meeting, I believe, will be your last meeting with us. Heather and Deborah Hawley are also ending their terms, but they are eligible to reapply.
Thank you, Jill. And I just personally would like to thank Moonwater and Byron, both of whom have been with us for the duration, for the contributions you've made substantively and just in your participation and setting the tone for the work that the task force has done for years now. Thank you so much for what you've contributed. Gonna miss you. Jack, do you want to take public comment? Or let me ask, is there any other business? Okay, seeing none, Jack, or Dan?
Just real quick, Moonwater and Byron, will you be at the next meeting?
I know we just approved the calendar, right? Was that January 10th?
Yes.
And I personally may actually have a conflict with that particular day. I'm going to see what I can do to be present if I'm able.
I think I'll be there for sure.
Okay, well, hey, Moonwater, if you're not able to make it, I just wanted to say thank you for all the work that you've done. You've been one of those people that has been able to take very complex conversations and provide form to them to kind of get us to the next step. So I just wanted to say thanks, and thanks for everything that you've done in the community. I just really appreciate it.
Thank you.
And Byron, I'm going to thank you at the next meeting.
Okie dokie.
Stephen,
Jack, do you
Gillier,
wanna
I just want to, as other business, just make sure everyone is aware over the next couple of weeks, council staff will be populating our 2022 calendar with all of the task force meetings, including invitations. So beware, you're going to see an email dump from us to load up those Outlook invitations.
Thank you, Jill. Jack, do you want to take us out with public comment?
I can, but I have a question for Jill first. Jill, am I correct in thinking that the terms were 4 years?
Yes, that's correct.
Okay, thank you. All right. I will also, Jill, likely need your assistance. We've got I see four people in the participants area, but that includes 2 members of the task force. But is there any member of the public that would like to speak? And if so, I think you can raise a hand or somehow, I think Jill will tell you how you can do that.
Yes, if you'd like to speak to the task force, please select the raise hand icon on your computer now. No hands are raised.
All right. All right, everyone. I don't think anyone's going to complain that we're half an hour under our scheduled time. It's good to see everyone, and for those of you that celebrate, have a wonderful holiday season, and we look forward to seeing you in January. The meeting is adjourned.